8:13 now, up to 62 today. 30% chance for showers. We're off to a cloudy start. Cold, windy tomorrow. Highs of 50. And then Saturday and Sunday, highs of only 44. Dr. B joins us. Dr. Brent Wallis, Chief Medical Officer over at People's Health. How you doing, Dr. B?
Hey, Tommy. I'm doing great. How about you?
I'm okay. You liking the brutally cold weather or not?
No, not at all. I'm ready for spring.
I am right there with you. Blood pressure, cholesterol, blood sugar levels all affect your health, and we all want to be as healthy as possible, so it's important to know what those levels mean, and that's what Dr. B from People's Health is going to discuss this morning and why it's important to know your numbers. And I guess, Doc, we start with blood pressure. What exactly is that?
Yeah, sure. So blood pressure is just the force of your blood hitting the walls of your arteries, and what we do is we measure it with two numbers, one over the other. For example, 120/80, you'll hear that a lot. So the top number is what we call the systolic blood pressure, and that is the force of the blood when your heart is beating. And then the bottom number, which is called the diastolic blood pressure, is the force of the blood when your heart relaxes between the beats. So that's how you get the two numbers.
So what is normal or the ideal number we should be shooting for?
Yeah, so what we consider a normal blood pressure is when that top number is less than 120 and the bottom number is less than 80. But the important thing to remember is that your blood pressure is going to change a lot throughout the day depending on what you're doing. So a single high reading doesn't mean you automatically have high blood pressure, but it may be a sign that you need to keep a closer eye on your blood pressure.
How common is high blood pressure?
Extremely, extremely common. In fact, it's one of the most common chronic health conditions that we see in America. And nearly half of all Americans, adult Americans, have high blood pressure, and that rises up to about 70% when you get into that older age category. So extremely, extremely common.
Why is it so important that you keep that under control?
Well, like I said, blood pressure goes up and down throughout the day depending on what your activities are. But if it stays persistently high for a long time, all that pressure on the walls of your arteries can cause damage. And it can damage your heart, making it harder for your heart to pump. And it can lead to a lot of serious health problems, things like kidney failures because of pushing too much pressure through your kidneys, or even stroke if you get that pressure up in your head. So that's why it's so important to know what these numbers are and have your blood pressure checked as often as you need to.
I'm presuming there are symptoms of high blood pressure?
Yeah, there can be, but, interestingly, a lot of times you can walk around with extremely high blood pressure and you don't notice anything. We call it a silent killer. And that's why these routine blood pressure checks are so important. Every time you go to a doctor, they're going to, put that little strap around your arm and we're going to check your blood pressure because you can have absolutely no symptoms at all.
What about cholesterol? Well, let's talk about that next. What exactly is that?
Yeah, so cholesterol is really, it's a waxy fat-like substance that floats around in your bloodstream, and it's also found in your body's cells. And it's very important. It's a very important chemical in your blood. It's important for building cells and nerves and even helping you digest your food. But if your cholesterol levels get too high, what can happen is you can develop plaques on the side of your arteries, on the walls of your arteries, and that can actually limit the blood flow. That can lead to something like a heart attack or even a stroke if you're not able to get blood where it needs to go.
How does that get into our bloodstream? Where do we get it from?
So a lot of people don't realize, but your body really makes the majority of your cholesterol. In fact, it makes all the cholesterol that you need, and then the rest of it we get through food that we eat. And typically it's going to come from animal products, so things like meats and eggs and dairy products. Those usually have the majority of the cholesterol. So about 75% is made in your body, and about 25% comes from the food that you eat.
Now, I've had doctors talk to me about good and bad cholesterol, but there's so much information that you get. I get confused on those two.
Yeah, it's pretty confusing. So, we kind of simplify it a little, and we do talk just about two types of cholesterol. There actually are more than that. But in general, you want to think about it this way. You've got LDL, or low-density lipoproteins, and HDL, which are high-density lipoproteins. And so, essentially, LDL is the bad cholesterol. We call it lousy cholesterol for the L. That's the one that can build up on the walls of your arteries and increase your risk for things like heart attack and stroke. And then the HDL is the good cholesterol. So think of that as happy cholesterol, because that one protects your heart and arteries. It actually can act as a scavenger and pick up little pieces of bad fat that are floating around in your blood.
I like that mnemonic device. Good way to remember it. Lousy cholesterol, LDL, happy cholesterol, HDL. So how do you go about determining what's a healthy cholesterol level?
Yeah, so again, it's pretty complex, but in general, you want to look at the total cholesterol. So it's the combination of that lousy and that happy cholesterol, and that'll give you a number. And the desirable level in general is going to be less than 200. But you may have a different target, so your doctor may talk to you about having a lower target for that cholesterol level, especially if you've got other chronic medical problems or maybe a family history of heart disease or stroke, because then they may want your cholesterol to be a little bit lower. So talk to your doctor about that number.
Now let's move on to blood sugar. What is that?
Yeah, so blood sugar is really just the amount of sugar, or what we call glucose, in your blood. And that glucose comes from all the food we eat, and it's really the body's main source of energy. That sugar goes into your cells and allows you to do everything that you do every day. But having too much blood sugar is actually the main sign of diabetes, and a lot of people already know that. It can cause many, many serious health problems, especially over a long period of time, things like stroke, heart disease, and kidney failure as well.
So are there symptoms of high blood sugar?
Yeah, there can be. Occasionally, especially kind of lower level elevated blood sugar, you may not have as many outward signs, but when it gets very high, you can develop a lot of problems. A lot of people will complain of fatigue, maybe some vision changes, blurry vision in particular. Some people may actually lose weight because they don't have a great appetite. They're not able to keep food down. And then other people may have increased hunger and drink a ton of water. Some people may have sores, especially on your feet, that may not heal very well. So if you have any of those symptoms, you want to talk to your doctor and get your blood sugar checked right away.
Let me take a break. When we come back, we'll talk about how you measure blood sugar and also about prediabetes. We're talking with Dr. B, our friend, Chief Medical Officer, Dr. Brent Wallis, Chief Medical Officer at People's Health, about blood pressure, cholesterol, blood sugar levels, and how all of that affects your health, because we want everybody to be as healthy as possible. 821 Traffic Now, WWL. It is 8:26 and a half. Tommy Tucker, WWL, Thursday morning, talking to Dr. B, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health, about being as healthy as you can. We're talking about blood pressure, cholesterol, blood sugar. We've already covered a lot of it. Now we were talking about the symptoms of high blood sugar, and now we're talking about measuring that. Doc, how do you measure blood sugar levels?
Yeah, so we've got two main ways that we use to test your blood sugar, and the first is called a fasting blood sugar test. What that does is it measures the blood sugar at one point in time, and we do that after an overnight fast, so no eating for about 12 hours. And that can be done at home very easily with a glucometer or a glucose meter that a lot of people have access to. The one thing to keep in mind, though, is, again, it's a fasting blood sugar. You want the number to be less than 100, but be careful, because if you eat something and you check your sugar, it is going to go a little higher, so don't let that worry you. And then the second one we use is called an A1C test. And that actually gives us an average blood sugar over the past 2 to 3 months. And the way it works is kind of interesting. You have red blood cells in your body that actually live for about 2 to 3 months, and they get covered in this blood sugar. And what we do with an A1C is we take that red blood cell out and pop it like a little powdered donut, and we count the sugar. And that will give us the number that gives you an average. And both of those tests can tell you if you have diabetes or pre-diabetes.
Let's talk about pre-diabetes. What is it? How do you prevent it?
Yeah, so pre-diabetes is really a huge warning sign. So what that means is that your blood sugar is higher than it really should be, but it's not high enough to be considered diabetes. So what that really is it's a warning sign that you need to act. You've got to act immediately and work with your doctor to help lower that blood sugar. And keep in mind that once you have diabetes, we can treat it, but we can't cure it. Whereas pre-diabetes is completely reversible. You can do a lot of things to actually lower your blood sugar and get rid of that pre-diabetes and never progress on to diabetes at all.
You do not want to do that. Any last information, Doc, before we wrap it up?
Yeah, I think the big thing is, a lot of people have high blood pressure, high cholesterol, and diabetes. You want to make sure you're talking with your doctor about these numbers. I tell all of my patients, know what those numbers are, especially if you're in a situation where you're talking to someone that's not your doctor, because you want to be able to say, hey, my A1C is, or my last blood pressure was. It'll really help them know what your condition is and how they need to treat you. And then keep in mind, too, that, we talk about this all the time. Healthy lifestyle choices help all of these conditions. So you want to make sure that you're eating a healthy diet and you're exercising for at least 30 minutes a day, 5 days a week. That's really going to help a lot.
Doc, I don't think we can overemphasize enough. If you are diagnosed with prediabetes, that needs to grab you and get your attention, right?
Yep, that's your red flag. So if your doctor tells you about prediabetes, don't just discount it. You got to do something about it right away.
Very valuable information. Thank you, Doc. Appreciate your time. Have a good weekend.
Thanks, you too. Stay warm.
You bet. Dr. Brent Wallis from People's Health. You can find out more about People's Health. You can meet with one of the representatives in person at the People's Health Medicare Center. That's in Metairie, 3017 Veterans Memorial Boulevard, next to Party City. Appointments are recommended, but walk-ins are welcome, and the Medicare period is closed, but People's Health is a 5-star plan. So if you wanted to change your plan, talk to them. You might be able to with People's Health being a 5-star plan. You can also visit the website peopleshealth.com or follow People's Health on Facebook and Instagram. If you download the Odyssey app, you can use the rewind feature and listen to what Dr. B just told us about, or you can wait till the audio is posted at WWL.com. We'll talk king cakes when we come back. Right now, time for WWL First News.